For decades, continuous glucose monitors, small sensors that track blood sugar in real time, were strictly for people with diabetes, and they were a genuine revolution for that community. But something new is happening. These devices are now being sold over the counter to people without diabetes, marketed as a window into your metabolism. Suddenly, healthy people are watching their blood sugar spike after a bowl of pasta. Is this the future of personalized nutrition, or wellness hype with a needle? Let's unpack the rise of the continuous glucose monitor. Let's start with what these devices are. A continuous glucose monitor, a CGM, is a small, coin-sized sensor you stick on the back of your upper arm. It has a tiny, painless filament that sits just under your skin, and it measures the glucose, the sugar, in the fluid between your cells, roughly every few minutes, all day and night. It streams that data straight to your phone. And that's the magic. Instead of a single finger prick giving you one number, you get a continuous, live graph of your blood sugar. You can literally watch it rise after you eat a meal, climb when you're stressed, and settle when you go for a walk. For people with diabetes, this transformed their lives, replacing painful finger pricks with constant, actionable information and dramatically improving control. That part is a genuine medical triumph. The new twist is who else is now wearing them. Here's the shift that changed everything. Historically, you needed a prescription and a diabetes diagnosis to get a CGM. But recently, the first continuous glucose monitors designed for the general public went on sale over the counter, no prescription, no diagnosis required. Products like Dexcom Stelo and Abbott's Lingo are marketed not as diabetes devices, but as metabolic health and wellness tools for anyone curious about their body. They're tapping into an enormous wave of public interest in blood sugar, fueled by social media and the broader conversation around metabolic health that we covered in our metabolic series. The pitch is seductive: see exactly how your body responds to different foods, and optimize your diet based on your own personal data rather than generic advice. It's personalized nutrition, powered by a sensor on your arm. And millions of healthy people are now trying it. So is this genuinely useful, or is it hype dressed up in a medical device? The honest answer is that there's truth on both sides. On the useful side, seeing your own glucose response, in real time, can be a remarkably powerful teacher. It makes abstract nutrition advice suddenly vivid and personal. You don't just hear that a sugary drink spikes your blood sugar, you watch it happen to you. That can genuinely motivate better habits, like taking a walk after meals or swapping certain foods. But now the skepticism, and it's important. For people without diabetes, blood sugar spikes after eating are completely normal. That's your body working exactly as it should. A healthy body handles these fluctuations effortlessly. So there's a real risk of the data creating anxiety about perfectly normal readings, or driving people to demonize healthy foods just because they nudge glucose up. And crucially, there's so far limited solid evidence that using a CGM actually improves health outcomes in people who don't have diabetes. It might just be expensive curiosity. So where does that leave us? It's really two different stories. For people with diabetes or prediabetes, continuous glucose monitors are a proven, sometimes life-changing medical tool, full stop. For everyone else, the healthy, curious crowd, they're best understood as an interesting self-experiment that can teach some genuine lessons, wrapped in a fair amount of hype. If you do try one, use it wisely, treat it as a short-term learning exercise to understand your general patterns, how a walk after dinner helps, which of your habits spike you most, rather than a device to wear forever chasing a perfectly flat line. Remember that normal spikes are normal, don't let it turn eating into anxiety, and don't use it to self-diagnose. The bigger picture is what matters. This is another example of a serious medical technology crossing over into consumer wellness, with all the promise and the pitfalls that brings. This is educational, not medical advice.